All right, thank you very much. I think it's good afternoon by now. Good afternoon, everyone. So we're going to be talking a little bit about the humanitarian part of the 2016 results, or the humanitarian achieved in the results achieved in a humanitarian context. I'm going to start immediately. I hope it works. Yes, it seems to be working. So, the year 2016 has been marked by first a rise in humanitarian needs, with more than 500 million children, which is 1 out of every 4 children in the world, actually living in a country affected either by a conflict, a natural disaster, or a health emergency. So 1 in 4 children living in a country doesn't mean 1 in 4 children affected directly by this crisis, but living in a country that itself has been affected by a crisis. And it has been marked by a number of particular characteristics. One is the number of protracted conflicts going on, and of course we all have in mind Iraq, Syria, South Sudan, Nigeria, Yemen, and others. It has been marked also by the important numbers of children on the move and the sub-regional dimension, a number of the crisis, whether children are migrating or refugees. It has been marked, unfortunately, by many of these crises, particularly the conflict, have been marked by some very grave violations of children's rights, particularly during moments of displacements, but other moments. And I think we all have in mind issues such as child detention, including in the fight against terrorism in some countries. We all have in mind child suicide bombers. We have all in mind other forms of recruitment and abuse of children, and of course sexual exploitation and abuse in a number of conflicts. It's been also a year marked by the impact of climate change across the world, and particularly El Nino in southern Africa, and the severity of natural disasters. And finally, it's a year that has been marked by a number of new outbreaks of disease, Zika, cholera, or new outbreaks of cholera, and of course yellow fever has been one of the issues. Now, of course, 2016 was the third year of the current strategic plan, 2014-2017, which is largely featuring saving lives, protecting rights through preparedness, response, and early recovery, but also looking at the underlying causes of vulnerability. We'll get back to that in a minute. The next strategic plan that you're all familiar with the discussions around the next strategic plan, again, clearly highlights the need for principled humanitarian action, or the centrality of a principled humanitarian action across the mandate of the organization. The continuing trend, of course, of complex and protracted crisis, the importance of us to work stronger and better, and I'll get back to it as well on the humanitarian to development nexus that actually also Joe mentioned earlier. Preparedness, risk informed programming, how we beef that up in particular, and our strengthened response in general. And of course, noting that in our response, and it's clear in the strategic plan, and I'll get back to it as well, is the importance of the centrality of the affected people to our response in general and our accountability to them. Now, the global response in 2016, UNICEF across the world has actually responded to 344 humanitarian situations out of 108 countries. So in 108 countries, we addressed 344 crises, humanitarian situations. That's about 69% of all our country offices. Of course, that ranges from localized floods somewhere that needed a rapid response and didn't last very long, to, of course, the protected and much more complex crisis that we talk about more. But that's actually the highest ever number of crises we've ever responded to, and the highest number of countries in which we responded to crisis ever since we've monitored this, which is back in 2005. So since that time, at least, it's the highest we've ever had to deal with. Now, some of the key results and the outputs in 2016 that for us are important, some of the global results. So as you can see here, 28.8 million children able to access safe water, 2.4 million children with severe acute malnutrition receiving treatment, 2.4 million children. This is as part of our humanitarian response. Obviously, there are more children receiving severe acute malnutrition treatment, for example, as part of the regular country program. We're talking here about the humanitarian response, but 2.4 million children receiving treatment. That's pretty significant if you think the number of lives saved that actually means. 3 million children accessing psychosocial support in humanitarian crisis. 24.2 million children vaccinated against measles. 11.7 million children able to access formal and non-formal education services, again, during a crisis. 34,000 HIV positive pregnant women receiving ART, and then 1.4 million children benefiting from some form of a cash transfer support to help them in different ways, and I'll come back to the issues of cash support. So these are significant results. You could see also the percentage to the target that we had fixed ourselves. In some cases, we are very, very close to the target. In some cases, we're a bit behind for a number of reasons that we can discuss further if you want. Example of country results. Well, for example, Haiti, after Hurricane Matthew, UNICEF had to step up its cholera response very significantly in the country, and we managed to immunize 360,000 children against cholera, for example. In Iraq, 1.3 million people receiving water, food, and supplies through a rapid response mechanism, which is this response mechanism that we're implementing in Iraq with WFP, and also we do it in South Sudan and other places, in some cases with NGOs, depending on partners. But it's this kind of very rapid first few hours immediate response where we combine both the assessment and the actual response. So we bring in supplies, and at the same time we conduct the assessment. So we really use the window of opportunity of getting access at a particular moment, knowing that this access could potentially be reduced later on. So it's an important feature of our work over the past few years, and will continue being so. We also want to say that in 2016, the flexible thematic funding has been quite important for us, particularly in addressing the issue of Syrian refugees, and being able to have actually the supplies to reach, and also in Nigeria, where it has been, the thematic funding has been particularly helpful in making sure we can step up a protection response, particularly the issue of separated and unaccompanied children, the reunification, identification, reunification of unaccompanied children, but also some work we've done on mine risk education in Nigeria. Now, when it comes to strengthening the humanitarian development nexus, UNICEF clearly being an agency that has this dual mandate of being a development organization and humanitarian organization, we feel very strongly that humanitarian action has to contribute to collective development outcomes and going towards reaching the SDGs, and that's the importance of our humanitarian response and the link we're doing with our development program. Now that goes through a number of ways. One is obviously how we're progressively informing our country programs when we're developing our country programs during our situation analysis and development of our country program, making sure it's actually informed by risks analysis and vulnerability analysis that itself is informed by humanitarian response. This is one thing. Through your humanitarian response, you identify the most at-risk population, you identify the most at-risk region and the main risk, and you can reflect, and you need to reflect that through your country program planning, which is what we're doing. It's also about strengthening the resilience of families. In 2016, just to give you an example, in India, for example, the work that has been done on flood-resistant or resilient, flood-resilient toilets and hand pumps to make sure that in areas where floods come regularly, the hand pumps, the water system, but also the sanitation system takes into account this issue. We've had the same discussion as well in the Sahel, where I was working before, on making sure that, you know, when we dig a borehole, we dig it a little bit deeper, even if it's a little bit more of an investment in the first place, but just to make sure we have a sustainable response in the way we're actually doing our work. Of course, investing in early preparedness, that has been the case in Madagascar, where we've prepositioned quite a lot of supplies to be able to face the effect of La Nina. Improving our accountability, inclusivity. This is the whole issue about how we increasingly work with affected population. In 83% of our responses, we've actually included the feedback mechanism from affected population. One example that was given to me recently was very interesting. For example, in the case of Pakistan, the way we've been using the Rapid Pro and U-Report system, which is basically, as you know, is the text message system, to be able to improve some of our water and sanitation kits that we're actually distributing to all families. And so we distributed the kits and then regularly kind of check back with the affected population whether the elements of the kits was actually meeting the needs and the requirements. Found out, for example, that some of the foldable jerry cans we had were actually of not exactly the quality we wanted, and so we could readjust that. On the other hand, some other items proved to be extremely helpful, and then we could have more. So having that feedback loop is extremely important. We're doing that in Iraq, for example, as well, in a number of other places. And of course, increasing the use of cash-based programming, like for example in Yemen, where 85,000 people, individuals, have benefited from it in 2016. It also, of course, also means, you know, how we, in places like West Africa, where I also worked before, how we're taking into account the Ebola crisis and what we've learned from the Ebola crisis to try to build or strengthen health systems to be able to face the potential new crisis from Ebola or elsewhere. Human resources, of course, are at the center of our humanitarian response. They are absolutely essential. So as you can see, in 2016, we've deployed 576 people, 576, which actually is a decrease from 2015. But the decrease is not that we had less people to deploy, it's just that we had one level 3 emergency with Nigeria in 2016, so one new increase, let's say, in our response. 2015 had a series of other L3s. But out of those 576 deployment, 247 were from standby partners, so other partners, NGOs, other partners who are actually seconding people to us. 462 were programs and operations, 414 were coordination, people working on coordination, and the largest deployments were to Iraq, Jordan, Lebanon, Syria, and Turkey. Expanded, we have an ERT, as you know, is our emergency response team. We have 14 members of this ERT at the moment. These are people who are constantly ready for deployment in different areas of our work, whether that's on coordination, whether that's on health, on WASH, on other sectors. And the ERT colleagues have been largely deployed during the course of the year. And we're actually at the moment considering increasing our ERT capacity, so we have more capacity to deploy rapidly the right staff. We've also worked increasingly on trying to improve the working environment for our staff. And that's basically better briefing, that's psychological support, looking at mental health implications of deployments, because we see that they're actually becoming more problematic, and also looking at how we attract staff better, keeping in mind that we have particular difficulties attracting women into humanitarian work at the moment. Supplies and logistics, 2016, UNICEF procured about $380 million worth of supplies. That's the supplies we bought from our humanitarian funds. So that's not the overall supply work of the organization. That's from humanitarian funds, and that doesn't take into account some of the supplies that have been procured by partners on our behalf, and with the funds we might have be able to give them. And we've deployed 39 people from supply division or supply chain in general to the field. And I must say, in general, one thing is been really important is how the global thematic funding has been key for us to pre-position supplies in areas like Chad, for example, and other countries where, using global thematic, we can actually prepare our supplies in advance in those countries, have them in warehouses, and be ready to actually react rapidly when we see that the crisis happens, or if a crisis happens. So again, the very useful thematic, global thematic. Rapidly on coordination, obviously we play this role in the sectors that you're seeing on the screen right now. And so in 2016, UNICEF has led or co-led clusters in 72 countries for WASH, 68 countries for education, 63 for nutrition, and 60 for global protection. So that gives you a sense of again, still the commitment of UNICEF in terms of cluster lead or co-cluster lead in some cases. Partnerships. Partnerships have, of course, remained extremely important, crucial for us. As you know, we also have a strong commitment in trying to increase the number of partnerships with local frontline responders and organizations, which we're doing. And so last year we've concluded 1,387 partnerships as part of our humanitarian response across the world, and you can see there the regions. These are not the numbers of different partners, but numbers of partnerships, keeping in mind that one partner could be partner in different locations, in different places. Now, key challenges in 2016, obviously, one is the increased complexity of some of the crises that we're facing, which is basically stretching our capacity to respond and having to make sure we send colleagues in all those different areas at different times and manage very complex environments. Of course, constrained humanitarian access, and that has been very much the case around the Syrian crisis, in Yemen, South Sudan, still very serious difficulties of access, Somalia, Northeast Nigeria, even though I would say we've definitely deployed our staff increasingly. We've opened a number of sub-offices during 2016 to be closer to where people needed us to be. But access remains a challenge, and this is why the rapid response mechanism is so important in getting to populations rapidly in the first hours as soon as we have a window of opportunity. Of course, the year has been also marked by grave violations against children, as I mentioned earlier, and that has been a key challenge for us. And of course, the issue of flexible funding that always remains problematic for us. We can talk about this further. Resource mobilization. Generous contributions from our partners. As you can see here, 80%, that's for, again, emergency response. And so humanitarian funding reached 1.6 billion by the end of 2016, which is an 8% decrease compared to 2015, so we have an 8% decrease. As an average, our appeals were funded at about 50%, but that varies greatly, some a lot more, some a lot less. Last year we've had difficulties, for example, in Afghanistan, we've had difficulties in Palestine, we've had actually better funding in some other situations. And of course the real importance, and again mentioning the issue of flexible funding, which brings me to the global thematic funding. UNICEF allocated about 28 million in global thematic funding for humanitarian action last year. And this is particularly important because it gives us flexibility. It gives us flexibility to reach less rich countries or make sure we get funding to the countries that attract less attention. But also it's a question of equity, making sure we actually reach children in areas where they probably get less attention, less media attention, less attention in the world in general. But also it helps us to look at some particular sectors that sometimes receive even less attention. So protection issues, for example, others. So depending, it gives us that flexibility to make sure we intervene in some of the areas where normally we would have more difficulty. And has been the case, for example, in Somalia. Has been the case in other locations. Expenses. If our resources have decreased by 8%, or the emergency resources have decreased by 8%, actually our expenses have increased by 8% because obviously some of the funds arrive at the end of the year, or some of the funds are over several years, so that explains why. And so 1.8 billion in 2016 were our expenses. And if you look, because now we have this way of trying to ask country officers when they do an expense to tag it as a humanitarian response or not, because obviously we know we're using some of our regular resources during the emergency response, or we use some of our other resources, all the global thematic in humanitarian response. So we're asking country officers to try to tag what they consider as a humanitarian response or humanitarian expense. And this is what you're seeing here in the graph. It's the blue lines, basically. So for example, an office like Lebanon considers that pretty much all of its expenses this year have been humanitarian, and you see the different countries there. But that means at the end of the day, when you look at this tagging of expenses, that about 52%, I'm almost finished, 52% of our expenses actually have been in humanitarian situations, 52%. Again, this is a rough tagging of expenses, so it needs to be taken as it is, but it gives you a sense of also how much some of our regular resources of global thematic is being used for emergency response. And it's interesting to see that out of the top 30 countries in terms of budget, so the 30 biggest countries in terms of overall expenditures, rather. So if you look at the 30 countries out of overall expenditure, 22 actually have a HAC, a Humanitarian Action for Children appeal. So it means that out of 30, 22 have a humanitarian situation that necessitates an appeal. Future work plan, so I won't spend too much time on that, but I mean, obviously our future work plan is to continue trying to struggle to be more effective and efficient in the way we carry out our humanitarian response. One is, of course, to strengthen the nexus between development and humanitarian work. Again, how do we contribute to collective outcomes? How do we contribute to the SDGs through our humanitarian assistance, but at the same time, how humanitarian assistance better informs our risk-informed programming and vulnerability analysis. That's important. Obviously, also the work we're doing with the Government of Canada to lead the work stream on multi-year planning and funding is quite key to us. We will continue advocating for more flexible and predictable and long-term funding, as I've been doing today. We will be trying to reinforce our work we're doing on accountability for affected population. This is something in which we believe greatly. It is extremely important in our interaction in humanitarian response that we have this dialogue with affected population to better inform our response, but also to make sure that, again, we're accountable, we're all held accountable by them, which we haven't done necessarily well enough. We will continue working strongly on having child protection and education at the center of our humanitarian action. There were discussions on education earlier, but child protection in general is key to that, and also how we are going to develop our capacity for a constantly principled humanitarian action, looking at IHL, looking at international human rights law, humanitarian law, human rights law in general, and how this is going to play a key role in our response. We will also continue expanding our use of cash-based programming as a way to provide a more dignified and sometimes more efficient way of programming, keeping in mind that cash is a tool, is not necessarily the end and the beginning of the end of the alpha and the omega to humanitarian response, but it is an important tool, and particularly Cash Plus when it's accompanied with other services in general, and of course how we're going to continue working with our colleagues and make sure that they are equipped for our humanitarian response in general. It's blocked, but that's okay because that was the last. I mean, there's another slide, but that was just to say thank you very much, and thank you for the partnership and all the supports over the past year and hopefully this year and beyond. Thank you.
Manuel, thank you.